Now we will move on to the third session of the day, and this session is about Vietnam. How, despite sharing a border with China, the country has managed to successfully curb the spread of COVID-19. To discuss this, we have with us today Dr. Todd Pollock, Harvard Medical School, Beth Israel Deaconess Medical Center. And talking to him today is Dr. Pooja Tripathi, GHHM South Asia Site Content Developer and Student Engagement Liaison with MSF. Welcome, Dr. Todd Pollock and Dr. Pooja Tripathi. Handing over to you now.
Thank you so much, Anupay. So let's start with this panel because I know we're running out of time a bit. So with the lowest number of cases and deaths worldwide, Vietnam COVID-19 response journey has been phenomenal, not only in Southeast Asia, but also across the world. However, before we start exploring some of the key factors responsible for this successful response, let me quickly sketch out Dr. Pollock's work. As an assistant professor of medicine at Harvard Medical School, an ID specialist at Beth Israel Deaconess Medical Center, Dr. Pollock is also the country director of the Partnership for Health Advancement in Vietnam, a Harvard University global program with a mission to improve healthcare in Vietnam. For more than 10 years, Dr. Pollock has worked to strengthen the capacity of the public health system in this country. He serves as technical advisor to the Vietnam Ministry of Health in the areas of HIV, infectious disease, and medical education. His work is supported by grants from the US CDC and USAID. Moreover, recently he was awarded a grant that in turn was dedicated to bolstering COVID-19 response in the country. Welcome, Dr. Pollock. We all have been hearing about Vietnam's much commended response to curbing the spread of COVID-19, as Aditi also just mentioned. Considering that the country shares a long border with China, is among the most densely populated countries, and an LMIC with limited resources and developing healthcare infrastructure, yet Vietnam has been lauded as a success story in managing and containing COVID-19. As of today, Vietnam has no more than 1,300 cases and has some of the lowest COVID-19 mortality in the world with only 35 deaths. Tell us more about the healthcare system in Vietnam and what are the main factors that contributed to overall success of the country's COVID-19 containment strategy.
Thanks, Pooja, and thanks to the organizers for inviting me to speak. Yeah, I mean, you're right. So you just talked about the numbers, and let me just repeat them because they're so really extraordinary. So, the official case count since the first case in January, end of January, is only 1,300 cases for the whole country. And this is a population of 100 million people. So, just to put that into context, Vietnam's response in terms of the numbers is sort of similar to countries like Taiwan and New Zealand. But of course, those are much smaller populations, and those are island nations, who don't have the long border, as you mentioned, as Vietnam does. So it's pretty remarkable. And we think about how, and the other statistic to mention is that there's been no cases detected in the community in Vietnam over the past 75 days. So there's still cases that are being detected that are coming in at the border, quarantined and controlled at the border, but nothing's being detected that's being transmitted within the country in the community for the last 75 days. So, and people are living relatively as normal here. So it's pretty remarkable. So how did they achieve that? And I think to understand how Vietnam achieved this, we have to understand the context of the country. So it is a low middle income country, and the healthcare system is still developing. And so I think the Ministry of Health would be the first to admit that the acute care system, the treatment system, still has ways to go. In terms of the quality of care that's prevented, but also in terms of the capacity, like, for example, numbers of ICU beds or trained staff who could manage ventilated patients or critical care patients is limited. And so I think this was, recognized early, and is one of the reasons why the country sort of went all in on prevention. Of course, we've seen many countries' health systems, even, the most developed or the richest countries, have their health systems become potentially, or close to the brink of being overwhelmed. And I think that was early recognized. The second thing is that although the treatment system is maybe still has a ways to go, the public health system has relative strength. And part of this is Vietnam has a lot of experience managing infectious disease outbreaks. So they actually have a standing standing committee for managing outbreaks that is like a control center committee at a national institute that goes down to the provincial level, with provincial centers for disease control in all 63 of the provinces to coordinate response. And this, is in action all the time. I mean, just a couple of years ago, there was a large measles outbreak, and just last year there was a diphtheria outbreak. And of course, most importantly, was that Vietnam was one of the countries affected by this first SARS outbreak in 2003, and was actually the first country to eliminate SARS at that time as well. And so I think there are a lot of, although the virus is not exactly the same, a lot of the lessons and experience from that certainly, I think, went into how they responded this time around, especially how rapidly they responded. And so that's the crux of your question, is like, what are the factors? How are they able to achieve this? And I think one of the main factors is the early and rapid response. And then then there's a long list of things. And I think the key point here is that now we're, 8 months into or longer into the pandemic, and we know a lot about this virus, and we know a lot of the different things that need to be done. And I think to summarize it for Vietnam is they did most of those things, and they did them earlier than most other people. So the things we're talking about is scaling up testing, doing border control, quarantine setups at the border, as I mentioned before, contact tracing, mask wearing for the population, communication strategy. So I think we can talk more in detail about some of those particular points.
Thank you. So those are some compelling area of elements that reaffirm the importance of preparedness and strategic response to deal with the infectious disease. You also hinted at isolation measures and rapid response to contain clusters. As almost 1/3 of the world population has been through one or the other forms of restrictions during this pandemic, including some restrictive mass quarantines we saw in India, Italy, China, and now in the UK again, I was wondering what the differences in Vietnam's approach were when compared to other countries with more advanced healthcare infrastructure that may have contributed to its success in curtailing the spread.
Yeah. So, as I mentioned, there was no question they were going to go for a prevention strategy and not a sort of flatten the curve strategy from the beginning, right? So that's the first point. I think the second point is, although the country would not admit, they would not say, of course, that it's an elimination strategy. The messaging here is still that we have to live with this virus, and and this is a new normal, and of course, people still wearing masks and everything like that. So that's still the case. But in fact, it was sort of an elimination strategy. What I mean by that is that they do not tolerate even one case in the community that is unlinked to a previously known case. So during their contact tracing, every case is contact traced. But if a case is found that doesn't have a clear link back to a chain of transmission, that is taken extremely seriously. And there is rapid mobilization of contact tracing teams and testing strategies to trace around that person and test widely around that case to understand the extent of this chain of outbreak, and do isolation and quarantine, isolation of cases and quarantine of contacts to pretty much break the chain of transmission. So I think one of the unique features is just this, sort of rapid response, and not accepting any cases of community transmission without trying to put all the efforts to breaking that chain. So I think that's one key point. Another point, of course, is that it's a nationally coordinated response. So I'm from the United States. We don't have a good nationally coordinated response, right? So we have different states doing different things. But in Vietnam, the response is coordinated. And what I mean by that is, of course, there's guidance sent down to the provinces but also you have, centralized quarantine centers being set up by the government, for placing people who are contacts into quarantine. And I think we can talk more about their contact tracing program. And of course, the border control measures, and also being able to move resources from one part of the country to the other. So, in Vietnam, of course, because they caught it early, they don't have countrywide cases. They have hotspots in different locations, and they're able to take available resources, whether it be testing capacity or healthcare, capacity, healthcare worker capacity, moving from one city, one part of the country to the other, in order to support that area in a coordinated fashion.
So you mentioned contact tracing, right? So, and in my understanding, it's the most fundamental of public health strategies conducted to prevent onward transmission. And I believe it's safe to assume that most of the countries have been directly implementing such measures during this pandemic. So could you please help decode what is unique about Vietnam's approach and why it was successful where some other countries have struggled and are still struggling?
Yeah, sure. So, I think first of all, there's kind of the architecture of the program, and then there's kind of the way that it was implemented that, made it successful, so that people would cooperate with the contact tracing program. So in terms of the architecture, so there's a couple of unique aspects of Vietnam's approach, as far as I can understand, knowing about other countries' approaches. Okay, the first one is that they isolate all positive all people who are infected, test positive in healthcare facilities, regardless of symptoms or severity of symptoms. So anyone who's positive is immediately placed in isolation in a healthcare facility. And what that does is that has allowed them to avoid any secondary transmissions, especially to stop transmissions in the household to perhaps elderly relatives who may have higher mortality rate. And this is one of the reasons why their death rate is so low, because a lot of the people who were infected were young travelers who tend to be younger, and they were isolated in facilities and not able to transmit to their maybe more vulnerable housemates. I think the second unique feature is in their contact tracing program is that they did contact tracing out multiple generations from the case. Okay, so you have the positive case, they designate that as F0 in their designation. Then you have F1s, those are the close contacts to the case. The close contacts are, once identified, they are quarantined in government facilities, and for the most part. And then, but that doesn't stop there. The F1's close contacts are then also traced. Those are designated F2. F2s will be, F2s, let's say low risk F2s are going to be asked for quarantine at home. Those high risk F2s, maybe they have symptoms or something like that. They may also be put into facilities. But the point being that if one of the F1s, the first generation contacts from the case, the first generation cases, contacts, turns out positive, they already know where all that person's contacts are. They already have a handle on that. So they can quickly, ensure the isolation and quarantine of everyone involved. And of course, we know the characteristics of the virus, that the incubation period is only 5 days, right? And you can be infectious for 2 days before symptoms. So, you only have about 3 days basically from when someone who is positive with symptoms, to find all their contacts and isolate them before they become infectious and spread the transmission further. So I think that's why this is so successful. The other part of the question is why do people participate so eagerly in the contact tracing program? And I think that has to do, one, with the communication strategy of the country. We can talk more about that, but the way the government communicated really mobilized the population fully in support. They had one of the highest rates of population being happy with the government's response, in the world when you look at the market research kind of surveys. So communication strategy is key. And the second thing has a little bit to do with Vietnamese society, which is very community oriented, is also very much focused on not the individual self, but the family and the neighborhood, and sort of understanding that you're doing these things to help your neighbors. I think that's somewhat part of the culture. And also the third thing is also the organization of the government system. It is sort of the party system they have in Vietnam stretches, all the way down into the community. So you have people in the village level who, sort of have some responsibility for organizing events at that level, and they sort of know everyone. So that, so there's a lot of community level trust, and I think that's very helpful. Was very helpful for making sure the contact tracing program was effective.
Thank you. You mentioned about communication strategy, and I remember watching that TikTok video which went viral to raise public health awareness. So if I were to draw parallels here with community mobilization, which you mentioned earlier, and underpin it on clear communication and active government-citizen cooperation, would you please elucidate why the country's public health communication strategy was so effective for the public, and also the fact that there's so much public trust in the government? So considering that.
Yeah. I really think communication is so very important, and of all the factors, this might be the top one. So from the very earliest time, the communication that was coming out of the government, so like their COVID response committee that was chaired by the Prime Minister and the Deputy Prime Minister, was very clear in terms of what is the potential risk of this virus, and clear in terms of what do people need to do to protect themselves. The communication was very transparent. So, a lot of countries, of course, publish their numbers every day, but in the Vietnam case, they published detailed information about every potential case, and detailed information about the contact tracing that's going on, where this person was detected in so-and-so street, and this many people have been contact traced, and even mobile apps that show the location of cases. Some might say too transparent in terms of protecting people's privacy, and we probably don't have time to get into that discussion, but the point is that the population saw that the government was doing everything they could possibly do to try to protect the people from this virus. And I think that really earned the trust of the population. I wouldn't say that the Vietnamese population fully trusts their government in all issues, but they really earned the trust of the population in the way they responded and the way they communicated about that. They also used a variety of different channels of communication. You already mentioned, the TikTok video. So, they funded sort of viral videos that taught people what is COVID and how to protect themselves. The one video was viewed 60 million times. They also sent text messages. I'm not sure exactly in other countries, but in Vietnam, in the first few weeks, I got 10 different text messages from the Ministry of Health instructing me about COVID and what I should do and where I should call if I need help. And in fact, if I look back, there was a text message in, I guess it was February, advising me to wear a mask. So way before WHO or US CDC advised mask wearing for the population. So, we haven't talked about mask wearing, but that's also a very important piece here. So different channels of communication, very clear, transparent communication. And the third point about communication is kind of the way the messaging was done. So one of the ways that it was done was providing communication in the sense that tapped into the national pride of Vietnam in defending their borders from enemies. So, talking about the virus as if it's a foreign invader, and that the population needs to mobilize, needs to come together to defend ourselves against this foreign invader. And this works very well in Vietnam because Vietnam has a long history of battling, foreign invaders, whether it be the Americans, the French, the Chinese, the Japanese, et cetera. And there's a real pride here that the country has been able to, defend those sort of stronger, let's say, invaders. So they tapped into that in the communication. I think is very effective.
Thank you. So before I can see a lot of questions coming. So before we move on to that, I just wanted to comment on this, that, I mean, we all have learned the hard way that lack of confirmed COVID-19 cases does not mean that there is no virus transmission happening in communities. And it happened recently in Victoria, Australia, and also in New Zealand in the past. So this brings me to my next question, that despite implementing comprehensive public communication activities, extensive quarantining measures, aggressive contact tracing, as you mentioned, and remaining COVID-free in terms of local transmission for 99 days, and having no reported deaths, a fresh wave of new cases was reported in Da Nang, which spread quickly to 15 provinces. What caused this resurgence, and how did the health authorities manage the second wave of cases?
Yeah, exactly. So I think this happened in June and July, and now, so as I said, the last 75 days, there's no more cases. So that outbreak has been controlled. Now, there was 99 days without community cases before that, detected, of course, and then that case was detected. We don't know, it's not known, or, where that case came from, or, how it got there. There's some theories that someone crossed the border and avoided quarantine from a neighboring country, but we don't really know. And I don't think it's that important. But I think what's important here is that, this caused more than 500 detected cases in the Da Nang area, and also spread because Da Nang is a tourist location, and there were a lot of Vietnamese tourists there who then returned to their homes and brought the virus back to, like you said, 15 different provinces. So this was the point where it seemed like this is now finally going to get out of control. But, it didn't. I mean, all the measures I've talked about, were put into place, and rapidly, and they were able to contain and put down this outbreak. And I think for me, it's sort of proof of concept of all the, of the strength of Vietnam's response to the pandemic. In the early days, there are a lot of questions about, is it really, the numbers really that low? And, is this, maybe they're missing something, maybe they're not testing, or maybe there's some other factor, maybe Vietnamese people have partial immunity, but then when you had this large outbreak in Da Nang this is where the 35 deaths came from and spread to other provinces, but then they put the public health measures into place and they basically crushed that pandemic. It's sort of proof of concept. There's not other factors that, that are, at least they're not the major contributing ones. It's really the public health response.
Thank you. So I can see a couple of questions, and I know I need to wrap up, Aditi. Just give me a couple of more minutes. So there's this burning question for Dr. Zihari. So because it's multiple times already posted there, could you please share any details about medical supply chain during the early phase of pandemic? So, I mean, how did that go about?
Great, yeah. So I guess you mean something like PPE. Yeah, so one of the early actions that they did was to accelerate production of PPE. So first of all, you have like the regular masks, like cloth masks. Now those are ubiquitous in the country at the baseline. We didn't talk about mask wearing before, but people wear cloth masks all the time, either because they're driving on a lot of motorbikes and there's a lot of fumes, or because people have a culture of wearing a mask if they're sick to prevent spread to other people, which probably dates back to the first SARS experience. So you already have a lot of people wearing masks, and you already have a lot of production of masks and a lot of masks in the marketplace. So we didn't really have much shortage of the cloth masks ever. Now the medical PPE was definitely a shortage. And I know in the early days, the hospitals that I visited were, they were trying to reuse surgical masks, and N95 masks were very, in limited supply. And again, this is, I think they managed this by the central control mechanisms, by moving PPE where it was needed, and two, because they sort of saw what was coming, they very quickly started ramping up domestic production. And now I think Vietnam is exporting to other countries. So I think that's how they manage that. But I think for sure, if the epidemic had exploded in Vietnam like it has in other countries, there would have been shortages of PPE. I mean, they didn't have on hand a lot of PPE, and people didn't have a lot of experience. I mean, one of the things that we did was go into the hospitals and train healthcare workers on PPE use, and for a lot of people, a lot of healthcare workers, it was the first time they put on an N95 mask.
Thank you. So there are a lot of questions actually, and if we are not able to take all of them, I would request to connect with you in the networking lounge. There are questions about your comments on the trust in the government, whether we can trust the information, the number, and the data. So I don't think, Aditi, do we have more time? No, right?
I'm sorry, we don't.
Sorry. I think I should have addressed the question about the data when I talked about the Da Nang outbreak. It's a very common question that I get, but I think we can fully trust the data.
Thank you so much. And just to encapsulate some of the key strategies, a firm commitment to a long-term investment plan to prepare and respond to public health awareness and emergencies, assurance to public through clear and transparent risk communication, vigorous contact tracing program, and proactive case management are the way forward to guard against another wave of COVID-19 and future pandemics. Thank you so much, Dr. Pollock, for sharing your insights on Vietnam's success in efficiently controlling the COVID-19 spread. Thank you. Over to you, Aditi.
Thank you, Pooja. Thank you so much.
Thank you so much, Dr. Pollock and Dr. Pooja, for this insightful session and the learnings from Vietnam.